views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Welcome to Public Health America, a 30-minute program on BronxNet where we talk with national experts to promote health and social justice. I'm your host, Dr. William Latimer. We begin by focusing on a current health topic from the COVID pandemic to cardiovascular disease. Our goal is to provide you with not only the best science, but practical tips to live a healthier life. On Public Health America, we also celebrate what studies have long documented, namely the unparalleled value of a college education by setting the stage to pursue a career of your choice, increase lifetime earnings and opportunity, and champion the ability to engage in civil debate. But for many, finding a path to college is neither clear nor certain. What if you're a high school student with supportive parents, but feel daunted by the prospect of being the first in your family to attend college? What if you're a single mother or father and want to attend college, but have no childcare? On Public Health America, our expert will also talk about decisions they made and support they received that helped them beat the odds. By sharing one or two life lessons, their stories may provide you with the inspiration and method to realize your dreams. This is Public Health America. Welcome to Public Health America. I'm your host, Dr. William Latimer. I'm here with Dr. Omayma Alshaarawy, Assistant Professor of Michigan State University Department of Family Medicine. Omayma, welcome.
Thank you. Thanks for having me today.
Yeah, so happy to have you on the show. So I know you've been doing some cutting edge work on cannabis or marijuana use and minimizing harm and maximizing benefit. Tell us a little bit about your work.
Yes. So cannabis has been the subject of many policy and public health debates recently. And so there are like two arguments within cannabis research right now. The first argument is what are the harms associated with cannabis use? Especially focusing on population which are more likely to be affected by its central effects. So, for example, I study pregnant women and how cannabis use affect their health outcomes.
Sure.
The other argument is there is lots of also debate on how we can maximize the therapeutic potential or even understand what's the therapeutic potential of cannabis and cannabinoids. So it doesn't have to be like THC per se, which is the main psychoactive constituent of cannabis, but it can be also CBD as well as other minor cannabinoids, which is available in the cannabis plant. So how we can understand the therapeutic potential of the of cannabis and the cannabinoid system, which is the system that cannabis act upon. So my research lies in those two intersections: how to maximize the therapeutic benefit as well as how to minimize the harms.
Sure. I mean, I remember, oh boy, I'm so old. 25 years ago, the director of the National Institute on Drug Abuse talking about how criminalization of marijuana use was probably a mistake. And at that time, that was a heretical statement. Now, fade in, fade out, 25 years later, many states have decriminalized and or legalized marijuana. And yet, you alluded to this, you know, it's a mixed bag, right? I mean, if you're a pregnant woman and you're smoking marijuana, whether you're smoking marijuana or cigarettes, that probably is having a negative impact. That said, there are probably beneficial uses of cannabis that are also in the frame. How does one, you know, this is so, it's such a complex issue. How does one educate the public about the difference between harmful effects and beneficial effects so that we are utilizing this substrate, this herb, in a way that is helpful?
Yeah, so there is a big issue right now within cannabis research, or I think for in my point of view, this is the biggest issue, is that we dealt with cannabis in a way that didn't maximize our research potential. So it's still Schedule 1 drug. There's lots of restrictions on research due to this legal status. Most of our research is limited by this fact, as well as limited by many of the regulations that are imposed on cannabis research. So if you ask me about specific health effect, and if you I'm studying, if you ask me, are you confident that this beneficial effect or this is harmful effect is caused by cannabis, I would just think a little bit before giving you an answer. I won't confirm a causal effect at this moment. And this is because we have lack of research on cannabis and cannabinoids due to some of the regulations, as well as we don't have well-designed studies. So you mentioned cigarette smoking and cannabis use among pregnant women. Yes, this is a big limitation because the effect we are seeing, is it because of if there's an effect on pregnancy outcome, an adverse effect, there are no well-designed study to answer the question, is this effect caused by cigarettes or is it caused by cannabis? Because there is lots of women who use both substances or both drugs. How to educate the public? I think we need to get to take a step back and design well-controlled studies and with adequate kind of regulations on cannabis and cannabinoids, and conclude something that's consistent, and then we can educate the public. So
better. What I hear you saying loud and clear is we need better designed, controlled studies that get to the heart of the question of the effect of cannabinoids, marijuana,
yes.
Versus other substances like tobacco.
Yeah.
Tell us a little bit more about your research. What directions is your work taking you these days?
So, in terms of, I would start with some of the potential therapeutic effects of cannabis and cannabinoids, and I stress on the term cannabinoids, which is so cannabis is a plant that can be smoked or ingested. That's the one which is associated with the central effects or the psychoactive effects. But there are other substances within cannabis, as well as other substance that act on the same receptors that or other chemicals that act on the same receptor that cannabis act upon. So understanding the therapeutic potential of the cannabinoid system doesn't really mean that we will use the herb itself as a drug. We have other options. So one of the things I'm studying is how cannabis affect metabolic health. So in our observation, we saw that cannabis users, even though we hear the term munchies and we were expecting that they gain more weight, they're actually less likely to gain weight than non-users. And so we're studying how this beneficial metabolic effect is being mediated. So we look at different receptors that cannabis act upon, and if modulation of those receptors actually is associated with a beneficial metabolic outcome. On the other hand, in my research on the harmful effect of cannabis, I study how cannabis affects first I study what are the motives for cannabis use among pregnant women, right? There is lots of discussions on cannabis being an antiemetic, and maybe that's why we are seeing an increasing trend of cannabis use among pregnant women, because the message here is cannabis can help with nausea and vomiting of pregnancy. I study those motives, and if this is really true, because on the other side we hear of a syndrome called cannabinoid hyperemesis syndrome, which is heavy nausea and vomiting among heavy cannabis users. So I try to see if actually cannabis relieve nausea and vomiting of pregnancy, or it goes the other way around, or cannabis increase nausea and vomiting of pregnancy.
Got it. So let me ask you this. If you were to say, what are the top 3 potential benefits of cannabis, and what are the top 3 potential harms of cannabis, what would you say?
Okay, so in terms of benefits, I would think like the first benefit, I would say it's somewhere around the topics of inflammation and pain. I think this is where there might be a therapeutic potential for cannabis. Inflammation, chronic inflammation, is a big issue for many of the outcomes, either chronic or acute. And pain has like one of the signs of pain is inflammation. So I would say within pain and within inflammation kind of background, this might be the first therapeutic goal for cannabinoids in general. After that would be it's things that I'm not studying, but there's literature on how cannabis affect or like kind of help in syndromes such as the post traumatic stress syndrome or anxiety disorders. So this is another thing. And of course, I would say number three is what we know so far about cannabis. FDA approved three THC based drugs for nausea and vomiting among patients who are receiving cancer chemotherapy, but keeping in mind that this benefit might be acute benefit, so that they receive like those drugs before chemotherapy and after chemotherapy till nausea is gone. Maybe long-term wise, heavy use might be associated with the increase in nausea and vomiting. For the harmful effects of cannabis, I would really like in terms of what I'm studying pregnant women, and now evidence kind of converged that might be a relationship between prenatal cannabis use and birth weight, as well as preterm births. So this is something that's starting to kind of come together recently. There's consistent evidence on this direction. Harms as well. There's of course there is harm associated with cannabis use among adolescents and young adults related to their cognitive development.
Got it. So with about a minute left, tell us, either from a research or a policy standpoint, what does your research lead us to? What is the next step? What do we want to convince legislators to do so that policies are implemented that are more humane and getting people the services they need?
I think the first thing I want to tell politicians or for policy development is actually enhancing the research potential for us, because what happened was lots of rapid changing cannabis policies, but there is like research lags really behind this rapidly changing policies. So the first thing I would or ask, I would plead for would be please enhance cannabis research more before changing the laws, of course. So that's I think that's the main message I have.
Great. So we're going to take a quick break. When we come back, Dr. Omayma Alshaarawy will talk a little bit about her personal experiences and how her collegiate experience set the stage for the great career that she's working on today. This is Public Health America. I'm Dr. William Latimer. We'll be right back.
you're struggling to afford your internet bills during the pandemic, there's a temporary government program that may be able to help. It's called the Emergency Broadband Benefit, and it provides up to $50 monthly discount on your broadband bill to qualifying households. Find more information about the program, including if you qualify and how to enroll, at fcc.gov/broadbandbenefit, or call toll-free at 833-511-03.
Welcome back to Public Health America. I'm your host, Dr. William Latimer. So, Omayma, in this segment, we talk about the personal lived experience of our guests. Tell us a little bit about where you were born and some of your formative experiences.
I was born in Egypt, in Cairo, Egypt in specific. I'm the second child. I have four siblings. And so even though there's another middle child, but I always face the challenges of not being the eldest and not being the youngest. I didn't grow up in Cairo. I was born in Cairo, but I grew up in a city on the east side of Egypt. I won't say it's rural, but it's semi-rural kind of city. Where I went through my elementary and middle and high school. And then I moved to Cairo again for college.
Sure. Okay. That's amazing. Tell us about where did you go to college and what was that like?
Okay, so first let me start by the process. It's much different than the US in going to college. So we have one national exam for all of the high schoolers to be able to go to college higher education. This is because higher education there is free, so you don't have to pay, but then it's very competitive. So it depends on your score, and
Yep.
depending on your desires, it's where you go. There always on and this was enforced in me by my parents, who always want to have a physician in the family. So I was studying to become a physician. Because of course, my parents had a role in it, but also because my parents, as I get close to college, both of them developed chronic diseases, and I was really eager to learn more about their diseases and to try to manage their symptoms, try to find a cure. I was a high schooler, so I thought I can cure the whole thing. So then I went to college in Cairo, Egypt, because Cairo University had the biggest medical school in the country and in the Middle East. So this was my target, and luckily I was able to get the scores to be able to join Cairo University, and I moved to Cairo for my higher education. It's different also from here. You can actually transition from high school right away to medical school, but medical school there is almost 7 to 8 years.
Sure. So, that's a wonderful story, and I'm sure you faced a lot of challenge. I mean, you're at Michigan State today. When did you emigrate to the U.S.?
In 2010. So I first moved to Morgantown, West Virginia, for my doctoral degree in epidemiology. And this is because, as I said, I was trying to go to medical school to cure two individuals, to cure my mom and my dad. And then as my colleagues who are within the public health field will say, we opted for public health to treat populations, or to manage populations rather than individuals. I actually moved to the US and started my doctoral degree in epidemiology, still to cure those two individuals, my mom and my dad. And this is because there were not many opportunities for research as a clinician. So I wasn't able to, research was very primitive back then, and I wasn't able to devote more time for research. So I moved in 2010 to Morgantown, West Virginia, to join West Virginia University, and I got my doctorate degree in epidemiology from there.
That's great. So you kind of paired the MD with the MPH or the PhD in epi, a powerful combination. Were there key mentors along the way, either in Egypt or in the United States, that helped you to advance your career?
Yes, of course, there are many mentors throughout my career. However, the person who had the greatest the greatest influence on me is Dr. Jim Anthony. I met him actually after my doctoral degree. I met him for a postdoctoral training in drug dependence epidemiology here at Michigan State. So I started here as a trainee in his program. And I really, he affected me because he thinks ahead. So he thinks 10 years in advance. Like at first I couldn't understand what he's thinking about, but then I started to get, he's looking at the bigger picture. He's always encouraging us as his trainees to look at the bigger picture and not to focus under our own steps, or focus on our own feet, if you say it like this. So he's one of the mentors, or he's the main mentor in my research life or professional life, so on, because of how he kind of look long term instead of short term.
That's great. So a critical message in your story is the powerful impact of a caring mentor who was able to give you the guidance to move your career forward.
Exactly.
And so as you progressed through your academic career at Michigan State, what are some of the signposts of the work that you did?
I'm sorry, can you repeat the question again? I couldn't
Sure.
hear.
Like as you progressed through your career at Michigan State, what's some of the work that you did to progress as a faculty member?
Okay, so So when I was a trainee, I was very focused on my research, and I wasn't able to develop collaboration skills or develop mentorship skills. As I progressed further, I think the two main things that I was able to add to my skill set is being able to collaborate with others and outside of my comfort area, as well as able to work with students on developing their research ideas and developing their research career, and enhancing their educational experiences in general. I think this is the main highlights of my of the progression of my career so far.
Sure. And as someone who came from Egypt, let me ask you this. Were there experiences that you had in Egypt, either in higher education or just generally, that helped you, that provided you the opportunity to contribute to the culture of Michigan State?
Yes. So in the U.S., there is lots of things that you can do without fighting for it. I would say, like, you can, if you want to do something, you can email someone and they will respond. You can go and work with someone on something. But the thing in Egypt is that really you have to fight for every step you do. There's lots of bureaucracy. So I would say the main thing which helped me from like back in Egypt was, number one, trying to be independent as much as possible, trying to depend on myself as much as possible, and try to be persistent as much as possible, because you will probably hear no, like, right away. But if you are persistent, this no can change into yes. So one of the things that I appreciated a lot from my higher education, from moving forward in Egypt in my medical career, was persistence. Those experiences helped me to be persistent in seeking what I want, and being independent as well.
That's great. So with about a minute left, if you were to give advice to a young person in the Bronx or a non-traditional age student in the Bronx or NYC about getting to college, succeeding in college, and the utility of college, what would that advice be?
I would say, like, my advice again is there are two skills in life. I think don't think like smart can get you somewhere. Don't think good luck can get you somewhere. I think the main two things that you have to focus on is your hard work and your persistence. Those are the two main things that you have to focus on. You can do it as long as you work hard for it, as long as you persisted or keep trying. So I think those are my two messages for students who are watching right now.
That's great. I want to thank Dr. Omayma Alshaarawy, Assistant Professor of Michigan State Department of Family Medicine. I want to thank our viewers for tuning in. I'm your host, Dr. William Latimer. See you next time on Public Health America. Take care.
Thank you.